Well, today I need to talk about epigenetics. Of course, that's the title of my new book out, Epigenetics, The Death of the Genetic Theory of Disease Transmission. And epigenetics, if you want to give it a definition, is the term that describes the ability to maximize your genetic potential, your genetic potential, by giving your genes, your DNA, your RNA, your telomere, which are the end caps in your chromosomes, what they need to maximize their potential for longevity, health, disease resistance, wisdom, memory, strength, speed, coordination, all the things that they control. Guess what? They can maximize their potential for the best that they can be, but they require raw materials, 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. And for the first time, each and every one of these functions, again, of your genes, your DNA, RNA, and your telomeres, is covered nutrient by nutrient in the book Epigenetics. 60 minerals, 16 vitamins, 12 amino acids, 3 essential fatty acids. And it's never been done before. This book is a kind of a standalone thing. People are just going crazy over the usefulness of this book, because if you want your kid to be faster and be on the track team, you better read what you can do to make him faster, right? This goes back to the 1800s when Charles Darwin's cousin, Francis Galton, talked about eugenics, how he could actually use the principles in the livestock industry of selective breeding to maximize your genetic potential. Squeeze every drop of goodness you have in your genes, your DNA, your RNA, and your telomere, which again, the end caps on your chromosomes. Don't hope and pray that it's in the food you eat. Don't just eat well, because you're not going to be able to maximize everything. You need to specifically give each and every important piece of the nucleus of every cell in your body, again, the genes, the DNA, the RNA, and the end caps, the telomeres on your chromosomes. It takes a lot of very obsessive thinking to get this done. It's all done nutrient by nutrient, body part by body part, body function by body function, in the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. If you follow the principles in this book, Epigenetics, you're going to be in control here. Okay? You're going to be in control. If you want to be a brilliant, a mind person, right? Have the best memory on earth, you have to read the book Epigenetics. If you want to be strong and be the one who just can outlift anybody in your weight class in the gym, you need to read the book Epigenetics. If you want to write a book, you want to maximize your ability to conceptualize what it is you want to do, you need to read the book Epigenetics, because you're going to want to give every nucleus of every cell in your body the maximum of what it needs to maximize their genetic potential. Your genes, your DNA, your RNA, the telomeres, which are the end caps on your chromosomes. And medical doctors are so far behind. The halls of science are filled with thousands and thousands of failed medical theories. Of course, some of the more recent ones are you're overweight and you're obese because you eat too much, you don't exercise. You have high blood pressure because you're using too much salt. Oh, you have clogged arteries because you eat too much cholesterol. Oh, you have a baby born with Down syndrome because you have bad genes. None of those are true. All of that happened because you didn't get all 90 essential nutrients in optimal amounts. And when you read this book, you're going to say, oh my gosh, it's just like you want a car that'll do a specific thing. You have to give it specific parts and specific fuel, specific transmission fluid, specific coolant for the radiator. You really have to ramp up. Well, if you want to do the same thing yourself, if you want to ramp up, you want to give your body everything it needs to give you the maximum potential. That's what we're talking about now, maximum potential. Just because grandmother lived to be 102 and was a drinker and a smoker doesn't mean you're going to get the same thing unless you give yourself everything she got. Now, I guarantee you she didn't know what she was doing. But by dumb accident, just by dumb accident, she was able to do things you're not able to do, but you have to consciously do them, okay? You consciously do them, but you're only going to consciously do them when you know what they are. And so you're going to have to be obsessive about this. Like myself, I've never been on a prescription drug. I turned 75 in June. I've never been to a doctor in the last 68 years. Actually, going on 69 years now, right? I mean, if everybody in America were like me medically, guess what? The medical system would be real humble because their patients only visit them once every 75 years. It's crazy, but you can do this, but you're going to have to be obsessive. And so you're going to need a MapQuest. You're going to need a GPS system to make this happen. And the GPS system to maximize your genetic potential for your genes, your DNA, your RNA, and your telomeres, the end caps of your chromosomes. The MapQuest is the book Epigenetics. It has never been done before to go nutrient by nutrient, function by function, and make everything happen. It's never been done before. It's only going to be found now. I mean, it's going to take years and years and years for other people to come up with anything close to this book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. I'm so excited about it. The reception of this book is going crazy. This covers everything. Your sexuality. That's right, even your sexuality. How you look, whether or not you get wrinkles, the color of your hair. Everything is found in this book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. Contact your Youngevity associate today and maximize your genetic potential. We'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
I got a couple of them today. I've got one here, a CNN story headline, even a few extra pounds can hurt your blood pressure. As they say, an extra 5 pounds you gained on vacation can do more harm than you think. This was all presented at the American Heart Association's high blood pressure research scientific sessions. They say even a small amount of weight gain can cause your blood pressure to go up, according to new research. And they say high blood pressure can lead to stroke and or heart attack, among other problems. An 8-week study constantly monitored the blood pressure of 16 people who were considered to be normal weight. They gave them an extra 400 to 1,200 calories a day in the form of a chocolate bar or a shake, and they gained about an average of 5% in body weight overall and saw their blood pressure rise. They say the systolic blood pressure increased from 114 to 118. While that is still considered healthy, they say even the slight gain was of concern. They say those who gained weight around the middle saw the biggest increase in blood pressure. And I think you could probably lower that blood pressure naturally without taking any kind of medications.
Oh, absolutely. Of course. And this is Sharon and I actually had a discussion about this the other day, that blood pressure, heart disease, a lot of it has to do with not salt and not cholesterol, but weight gain and a process called PAD, peripheral artery disease, where the little microscopic arteries are getting plugged by inflammation, eating fried foods, processed meats with nitrates and nitrites, oils, olive oil, coconut oil, margarine, mayonnaise, celery, cooking oil, and gluten. All these things cause inflammation. And the PAD, the peripheral artery disease, plus the weight. When you gain 5 pounds or 10 pounds, you're talking about hundreds of extra miles of microscopic arteries and veins you have to pump that blood through, and so blood pressure goes up to accomplish that, especially if you have PAD at the same time, peripheral artery disease. So here's where I would throw in the Ultimate Daily tablets to the 90 essential nutrients, and they're designed to support and promote actually healthy blood flow through obstructed arteries and support and promote healthy blood flow and blood pressure. And then also, I would take the ASAP, 1 dropper full under the tongue, 30 minutes before each meal, to help accelerate weight loss.
Yeah, I got another one here, Doc. This kind of goes to what you were talking about in your monologue, and it's a new way to stop aging. I thought, they must have read Doc's Epigenetics book. They say the cure to ending aging may be lurking in your cells. UCLA researchers suspect that they're finding the key to activating a gene called AMPK. When it was turned on in the lab with fruit flies, they found that the mechanism, which is designed to help the cells keep themselves cleaned out, gets rid of cellular garbage such as protein plaque, which is believed to be playing a role in some diseases like Alzheimer's and Parkinson's. They say they weren't able to do this in humans, but they say the good news is that activating this gene in the fruit fly increased its lifespan by 30%. And even better news, the fly stayed healthy until old age. They also saw that when they activated the cell in one part of the fruit fly, such as the central nervous system or the intestines, it slowed aging throughout the entire body rather than just that one area. So it's genetic again.
Well, it's not genetic, but it is maximizing the genetic potential. We've done this in fruit flies by giving them all 90 essential nutrients. Whereas the human beings, they try all these things. You might you use 100 people that are the same age demographic, the same weight, the same gender, but then they're all eating 100 different types of dietary practices. And so and none of them are even close to 100% of the 90 essential nutrients, whereas the fruit flies are. The fruit flies are. Say that 100 times. But anyway, you're exactly right. if everybody would take all 90 essential nutrients, perfectly appropriate for body weight, and then do the immortalium, do the 90 essential nutrients, guess what? They would maximize their genetic potential. And by the way, the plaque has nothing to do with disease. It's just filling in holes. Saying the plaque causes disease like saying wood ashes cause forest fires. Thank you, Doug. And we'll be back after these messages. Well, if you've been listening to your doctor and he says you're overweight because you have eaten too much or you don't exercise enough, fire him, because actually it's a nutritional deficiency to be overweight and obese. That's right, it's a nutritional deficiency. Take the nutrients, it goes away. Whoop. Okay, Doug, let's go to callers.
Let's head to Oregon. And Helen, you're on with Dr. Wallach.
Well, Helen, you're on the air.
Yes.
How can I help you?
Okay,
Hello?
my husband is been diagnosed with low thyroid, weak immune system, a weak nervous system, Epstein-Barr viral infection, and he's had low sodium. And he's tired a lot of the time.
Okay.
And he has confusion, and he's mixed up with hallucinations and stuff at times.
Okay, how old is your husband?
79.
Okay. Now, does he have any history of asthma or bronchitis or respiratory problems?
No, but he has had gluten intolerance.
Okay. Very good, thank you. Now, does he have any history of skin problems?
Yes.
Okay. Like eczema?
A lot of that was from is from his gluten intolerance.
Mm-hmm. Okay, very good. We're on the same track there then. Okay, so we have maybe early stages of dementia, confusion, and so forth. He's got low thyroid. His immune system is low. He's tired all the time, fatigue, which is a very common complaint when you visit a doctor. Okay, this is a Shar thing. What's going on here, Shar?
First of all, he has a gluten intolerance. And how much does he weigh so we can
How much does he weigh?
I would say approximately 130 to 35 right now. I'm not quite sure.
Okay, but he's a small man physically, okay?
Okay. He needs a healthy brain and heart pack, but he also needs extra Ultimate Daily, and he needs extra de-stress, and he needs the Ocean's Gold for the thyroid.
Okay, an A+ girl. That's very, very good. And I'd go ahead and give him 3 of the Ocean's Gold twice a day. For his immune system, the 90 essential nutrients is certainly going to help him there. The Healthy Brain and Heart Pack, I'd get an extra bottle of selenium so he could have 3 twice a day. And then, of course, he'll have a tablespoon and a half ounce of the Osteo at breakfast and dinner, 1 scoop of the Beyond Tangerine 2.0 at breakfast and dinner, and 3 of the EFA Pluses in the morning and 3 of the EFAs at night. All that would be accomplished by the 1 Healthy Brain and Heart Pack, extra bottle of selenium, and 2 bottles of Ocean's Gold. Now, for the dementia, I'd throw in one more thing. What if he has blockages of the heart, which might make him tired? What if he has blockages of the brain arteries, Char? What would you give him?
You mean CardioFX or something?
No, how about Ultimate Daily to open up the arteries?
I already said Ultimate Daily.
Oh, you did? Okay, well, okay, I apologize. Okay, I'm sorry. Okay, Ultimate Daily is 3 twice a day. That's 1 bottle a month. Get the blood flowing through his obstructions artery. Then give us a call every couple of weeks, Ellen. We'll be back after these messages.
Let's head to Arkansas. And Daniel, you're on with Dr. Wallach.
Oh, Daniel, you're on the air.
Hello, Dr. Wallach.
Yes, sir. How can we help you?
This is regarding my mother. She's 84 years old. She was just diagnosed with breast cancer. And one of the things is the procedure that the way they did it with her, I'm in questions of. They found a large lump in the right breast. They called her in as an outpatient. They went in there, they removed the lump, and did not do no biopsy on it beforehand. And they put a drain tube in and sent her home. I'm not sure if that's appropriate for a person of that age or not.
Well, what should I say, 84 years old. It comes down to opinion, whether they're physically able to withstand surgery and so forth, if surgery is appropriate. Is this a cyst? Is it a benign tumor? Is it a malignant tumor? You can do a lumpectomy. It's not unusual to do a lumpectomy, especially when the lump is very well encapsulated. In other words, it doesn't have finger-like radiation sticking out all over the place. It just looks like a little baseball or a grape or something like that, and they're well-defined. They can go in and take out a little bit of normal tissue around the outside of that lump, and they do what's called a lumpectomy. That's a very common procedure. But I guarantee you, they did do a biopsy of that removed mass, okay? They would look at that under the microscope and determine whether it's benign or cancerous. And what you need to do is ask them for a copy of that pathologist's report and read the summary to me. Read the comments or read the opinion to me. This will be the last paragraph on those reports. I've made many of them myself, and so I know what they look like. And then I can give you more information. But what does your mom weigh, Daniel?
She weighs around probably, I'm going to say around 160 pounds.
160, okay. Well, what I would do, just for good measure here, I would go ahead and give her 2 of the Healthy Brain and Heart Packs per month. That would allow her to have 3 selenium twice a day, 1 ounce of the osteo twice a day, 2 scoops of the anti-tangerine 2.0 twice a day, 3 of the EFA pluses twice a day, and 3 of the EFAs twice a day. That'll all be accomplished by 2 of the Healthy Brain and Heart Packs per month. But then I would throw in something else for the immune system here, because your immune system is your best friend when you have any kind of cancer, including breast cancer. Shar, what would you like to throw in for this lady? And remember the Clemson reports and so forth. What would you give her?
She needs the Ultimate Classic. I would give her Extra Classic because that kills. It's been proven to kill cancer tissues. Yeah,
it kills actually breast cancer in cultures of human cells with breast cancer. Absolutely. And so I'd give her an ounce of that Ultimate Classic at bedtime. I'd also give her 3 of the Ocean's Gold twice a day. That's 2 bottles a month. And then call me with the results of that lumpectomy. They will have looked at it under the microscope. I'm going to know what that pathologist saw. We'll be back after these messages.
Let's head to Tennessee, and Linda, you're on with Dr. Wallach.
Hello, Linda, you're on the air.
Yes, I was just calling because I'm overwhelmed. I've gone to alternative doctors because I have a lot of health issues, chronic acid reflux for almost 30 years. I did buy y'all's product, Ultimate Classic, and tried to take it, but was told from a doctor that deals with acid reflux that because it has citric acid in it that I wasn't able to take it. And sure enough, when I started taking it, it was really bothering my acid reflux really bad. So I'm just very down and very frustrated about how to get my digestive system
Okay, what do you weigh?
Again.
Okay, Linda, I got the picture. What do you
my
weigh?
Weight's down. My weight's
I don't
down
care.
Right
what do you
now.
weigh?
I'm actually about 105.
Okay, how tall are you?
5'3".
Okay. That's pretty good for 103. That's pretty good. I like that. Do you have any other issues, any skin problems?
I've got tons of issues. I don't know if you have enough time. I
don't have enough time. I want specific. I want specific answers to specific questions. I don't want you just rattling on, okay? So, do you have skin issues?
Not right now.
That means you had them in the past.
I did, like maybe 20 years ago. I had bad itching, but I haven't had that in a while.
Mm-hmm. Do you have respiratory problems, bronchitis or asthma?
No.
Okay. Do you have any bowel problems, any constipation, diarrhea? Do you have your appendix out?
I have the diarrhea and constipation. The constipation is horrible. I have not had my appendix out.
Okay. Very good. Okay, Shar, this is a Shar thing. What would you say about acid reflux, Shar?
Well, she's probably got a gluten problem, but also the enzymes. She can try the enzymes and see if they help. Mm-hmm. It's gallbladder in a bottle.
Yeah. Well, is there such a thing as acid reflux?
No, it's a lack of acid reflux. She doesn't have enough stomach acid, and that's what's coming up is the bacteria from her upper intestine has got up into her stomach because there's no acid to keep it down.
There you go. Yeah, your stomach should be sterile, as Shar says. And when your pH in your stomach starts rising towards the neutral, it should be below 2. 1 being the most acid, 14 being the most alkaline, 7 being neutral. Your stomach environment should be below 2. It should be like 1.2, 1.5. It gets up around 4 or 5 and starting creeping towards the same pH as vinegar. Gets up moving towards 7, which is absolutely neutral. Yeast and bacteria grow in there, as Shar said. And then every time you eat, the environment is perfect. It's warm, it's dark, food is in there. Here comes moisture. And yeast and bacteria will grow, and they begin to ferment things and generate gas, which causes heartburn, reflux, not acid reflux, but lack of acid reflux. Okay, and in addition to the healthy digestion pack, Shar, and 105 pounds, I'd have her take 1 healthy digestive pack per month, divide everything in half a dose of breakfast, half a dose of dinner. The ultimate enzymes, as you point out, also called gallbladder in the bottle. I'd have her take 1, say 2 to 5 minutes before each meal, a couple ounces of water. But what other thing might you add before meals and during meals and after meals to kind of really very quickly, almost instantly, resolve reflux, lack of acid reflux symptoms?
A couple of drops of peppermint in hot water.
Perfect. Now, we've seen people reverse years and years. I mean, one gal had 12 years. She was a wife of a pastor, had 12 years of, I mean, the most horrible reflux I've ever seen, belching every 3 seconds. How long did it take her to resolve those symptoms with 4 drops of peppermint oil and a cup of hot water?
Less than 15 seconds.
I mean, that was dramatic, wasn't it?
Yes, it was very dramatic.
Okay, so I have witnesses there, Linda, so you need to do that. Get the healthy digestive pack, and then, of course, you want to get our Ancient Legacy peppermint oil and put 4 ounces, not 4, I take that back, 4 drops, 4 drops of the peppermint oil in 8 ounces of warm water, and you can sip on that through your meal, and whatever's left of that cup at the end of the meal, just down it, and you won't have reflux problems. Now, do salt your food to taste. If you've restricted salt, that's the cause of your reflux problem or your reflux problems. Okay, lack of salt. Salt, sodium chloride, is the raw materials for your chief cells in your stomach to make hydrochloric acid. All right, so you do need to salt your food, and in the meantime, take the healthy digestive pack, which includes the ultimate enzymes, which has stomach acid in it. It never is acid reflux. It's always lack of acid reflux. And every doctor who tells you it's acid reflux gives you proton pump inhibitors and tells you to stay away from salt should be put in jail for insurance fraud. Okay? It's absolutely terrible what they get away with. They're just telling you the opposite of what the problem is. And that's why it goes on and on for 30 years. As you said, you've been suffering with this problem for 30 years because your doctor's been giving you misinformation. I'd get online and fire the doctor, because you're going to be amazed at what happens when you follow this little instruction that Shar and I gave you, okay? Give me a call every couple of weeks, because you're going to have a great testimony here, Linda. Okay, Doug, we have time to start another one.
Yeah, let's head to Michigan. And Kathy, you're on with Dr. Wallach.
Hello, Kathy, you're on the air.
Hi, thank you, Dr. Wallach. I'm a 60-year-old female, 120 pounds, just a little under. I have a couple of issues here. I have a lipoma on my upper leg that I am interested in learning more about. I have dark circles under my eyes. I have all my life, and I have some spider veins. I'd like to see them disappear.
Okay. Now, do you have any history of dry skin, eczema, dermatitis, psoriasis, or rosacea?
Yes, but not for probably 10 years or so.
Okay, but you had it as a younger woman.
Yes.
Okay, did you ever have anything like asthma, bronchitis, chronic colds every winter?
Runny nose, but that's about it.
Okay, any bowel issues?
Constipation.
Okay. Okay, this is a Shar thing.
Yeah, she's definitely got a gluten problem, and the dark circles under her eyes are allergic shiners, so she's obviously eating things that don't agree with her.
Mm-hmm. Yeah, and just giving up gluten might get rid of those allergic shiners, the dark circles under your eyes. Exactly right. In the lipoma, that can go along with something irritating. You might be sensitive to the chemicals in pantyhose. You might be sensitive to detergent that you're using at home. And what happens is when you get irritation substances that are absorbed through the skin, it's not unusual to get lipomas under the skin. And if it's small, like a lima bean laying flat under the skin, you can move it, and it's not really an irritation, I just leave it alone. If it's big enough, if it's the size of a lemon and it's interfering with daily life, then you might want to have a local anesthesia, and a little bit of a hypnotic or something in a dermatologist's office and have it removed. I would not go under general anesthesia for it, but a hypnotic, it's almost like the old days where surgery, they'd give you a shot of whiskey and then they go ahead and take the bullet out of you, right? Well, a hypnotic can be a little bit of laughing gas like they use in a dentist's office, or it could be an injection, and then local anesthesia. Taking out a lipoma is like a 5-minute surgical process in 2 or 3 stitches. But I'd have plenty of other professional people around there just in case. We'll be back with more Truth, Justice, and the Longevity Way after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity 95 Crusade. And Doug, let's go to callers.
Let's head to Redding, California. And Charlotte, you're on with Dr. Wallach.
Charlotte, you're on the air.
Hello. My husband, he's 74 years old, and he weighs 155 pounds, and he suffers from ED.
Okay. All right. ED can be caused by lots of things. Does he have any skin problems or respiratory problems?
No, he's very healthy, yeah.
Okay. And has it been going on for a long time, or just last year or so? Or
2 years.
2 years. Okay. Okay, Shar, you can deal with this. 78-year-old guy, 155 pounds, erectile dysfunction. Where would you start? What basic things would you begin to do for this guy?
I would have him eat a lot of eggs.
Okay, yeah, I'd like to have him eat 6 eggs per 100 pounds of body weight, so he needs 9 eggs a day, 8 to 10 eggs a day, poached, soft-boiled, soft, and that's for the cholesterol, because testosterone, which is required for erectile function, and testosterone production is 95% by weight cholesterol. If he's on statin drugs, he's got to get off of statin drugs, but I'd have him eat 8 to 10 eggs a day. He could eat 25 if he wants, but no less than 8. Okay, and then what supplement program would you put him on, Shar?
I would get him on 2 healthy brain and heart packs, and then I would give him extra Ultimate Daily to open up any afferent arteries that are plugged up, because he could have plugged up arteries in that area of his body that would cause all that problem.
Okay, exactly right. I'd give him 1 bottle of Ultimate Daily tablets, as Shar says. That's 3 of the Ultimate Daily tablets at breakfast, 3 at dinner. I'd go ahead and give him 2 healthy brain and heart packs per month. That allow him to have 3 selenium twice a day. And selenium is to the testicles as iodine is to the thyroid gland. Very, very important here. And so then 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses twice a day, and 3 of the EFAs twice a day. All that's going to support and promote healthy production of testosterone and blood flow and everything necessary to make things work. Okay? And give us a call every couple of weeks and let us know how things are going, because everybody's going to be happy in this deal. Okay? Very, very good. This is easily resolved, but you got to get him off of statin drugs. Make sure he's eating a minimum of 8 eggs a day, as Shar said. Okay, how much time we have here, Doug?
Just a little over 90 seconds.
90 seconds. Okay, Shar, it's time for you to give one of your bits of wisdom here. What advice would you give to people who want to maximize their genetic potential for longevity and health?
Well, I think over the years, I get so sick of hearing people say, I got to ask my doctor. And if they would look up the statistics, the medical profession is the #1 killer of Americans. And it's not even a question of are they? They are. And it's statistically proven. So first thing is, don't ask your doctor anything. If you want to live, stay away from them and go natural and take all the stuff, get natural food, try to eat clean food that's not genetically processed, and get on our healthy start pack. If there's nothing wrong with you, get on 1 healthy start pack per 100 pounds of body weight, and you'll maintain your good health for the rest of your life. The goal is to be functional right up to the last day of your life, go to bed at night, and just don't wake up in the morning. That's the way it should be, and that's the way it is for most people.
When was the last time you went to a doctor for being sick?
Well, the last time I even had a medical doctor was over 25 years ago, but I wasn't even sick back then.
Okay, stop. And how long have you been taking the 90 essential nutrients?
About 25 years.
Now, do you think that's a coincidence?
No, I know it's true. I know it's the real thing. My sister and I both thank our lucky stars that we met you, that we got. I was taking stuff from the drugstore. I had no idea the difference in quality and, the ingredients. I mean, we got stuff that's really superior to anything else on the market. And
well said, young lady. Thank you very much. And thank you so much. A good job. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.